And we have Miss Hope and It's Hope. It's Miss, eh? Mrs. MS. We have Miss Hope Nakawuma with us, and she is a clinical officer at Rocket Health Uganda. Welcome to the show, Hope.
Thank you.
Oh wow, I love Hope. She's very soft spoken, but she has a well of knowledge that spews from her. And welcome to the show. And we just want to start off by discussing about breast cancer in Uganda in particularly. I did read a study that said cervical cancer is the leading cause of death in women in Uganda, but breast cancer comes closely second. Could you just speak on the prevalence of breast cancer in Uganda?
Welcome everyone to the show. The prevalence of breast cancer in Uganda, according to a recent study that was done by the Fred Hutchinson Cancer Research Center in Uganda last year in June, a study was carried out on a population of 100,000, let's say, women. And among these, 21.3 of these women were found to have breast cancer. They presented with the disease. And then it was still that when they gauged the fatality rate, by fatality I mean the rate at which women died from the breast cancer, it was found that 10.3 of the 21.3, 10.3, that is around half of the population that presented with breast cancer. 10.3 of these women succumbed to the disease. They died from it. So that really opens up our minds to know that breast cancer is really fatal. It is a serious burden of disease, and it's something that we are supposed to take to be cautious about as women. And most of these women in this study presented with the disease in the late stages. Unfortunately, in the third, the disease, breast cancer has 4 stages: the first stage, second, and third, and fourth. And most of these women presented when they were in their third and fourth stages.
Much in the later stages.
Yes, in the later.
You just talked about the statistics, but what we want to know, what are the leading causes of breast cancer?
There are causes, as we may say in quotes, of breast cancer, but I would like to put this right. All cancers, for this applies for all cancers. The exact cause of a cancer is always not known. Yes, it's not like, I'll give a simple example to let everyone understand what we mean. When I say that breast cancer, the cause for breast cancer is not known. For example, it is very clearly known that when you're bitten by a mosquito, you will suffer from malaria. So it is plain knowledge that malaria is caused by, when you're bitten, I won't go into the details of what happens, but when you're bitten by a female Anopheles mosquito, that is when someone gets malaria. This is not the same case with breast cancer. They are just rather risk factors, or we call them predisposing factors, that can predispose someone to getting breast cancer, or increase the risks of one person increasing the risks of one person getting breast cancer than another.
So the question should be, what are the predisposing factors?
What are predisposing factors? Yes. Who is at risk of developing breast cancer? All this is entailed in one thing. First of all, the very first one is gender. We know that both men and women have breasts. The size doesn't matter. There are women that still have smaller breasts, depending on their rate of activity and then genetics. But someone being female puts them at a higher risk of developing breast cancer than a man. And it's not necessarily about the size of the breast. It is about the hormones. Yes. We know, like in primary school and then early secondary time, at least everyone has learnt about the different hormones in men and women.
Estrogen.
Yes, we have estrogen. We have the feminine hormones, and then we have the masculine hormones. Right. And surprisingly, which maybe most of us didn't know, a man has a certain level of female hormones and male hormones. And then a woman also has a certain level of male hormones and then feminine hormones.
That's true. I do see athletes who are actually having trouble with the
Semenya.
athletic committee.
Of South
Yes,
Africa.
yes.
But God created us in a way that these levels are supposed to be minimal. When it gets to a woman, your feminine hormones are supposed to override the masculine ones, and the same for the men. The masculine hormones are supposed to override the feminine ones. So in case there is an imbalance, for example, in a man, if a man finds himself having high estrogen or progesterone levels, which are supposed to be in men,
In women.
in women, that can put them at a risk of developing breast cancer. Like we know, they can present with a soft voice, those other things. So the female hormones have a role they play in causing breast cancer, or I don't want to use the word again, in predisposing a human being, let me say, to breast cancer. We women have those hormones in a higher level, that is how God created it, and men have them in lower levels. It is just like a small percentage of men that you will find having such a hormonal imbalance where their feminine hormones are overriding the masculine hormones. Yes, so that is why women will suffer more from breast cancer than men, because of the hormones. And still we will learn that these hormones in the course of our lives as women, like I said, that is why we can't say breast cancer has a cause. That in the course of our life as women, still you will find that these hormones have roles they play. We have heard, like from lay people, when you take long to give birth, you will suffer from breast cancer. When you don't breastfeed, you will suffer from breast cancer. It still rotates around the same thing, as we will learn later. So the other predisposing factor is age.
Okay.
Yes, the older we grow, the higher the chances of developing breast cancer are. Like we know for other cancers. Why is this? It's because even if there is no history in your family of breast cancer, even if you don't have these hormones in high levels, age can contribute to someone developing breast cancer. Why? Why is this? We know that we didn't talk about how a cancer develops, but it's in simple terms. In a very brief explanation.
Layman.
Yes,
No
no biology. There will be no biology. So breast cancers, all cancers, this is how they happen. So now the only time we'll change that, now we are talking about the breast. The body has a natural process of killing cells.
Dead cells?
Yes, dead cells and abnormal ones. Like our bodies are not computers. There are those times you'll have abnormal cells, they die off. All cells have a certain age.
Yeah, lifespan.
Yes, lifespan. They are not supposed to exceed. So for a cancer to develop, sometimes this lifespan what happens? Okay, it goes beyond. These cells
they exceed their lifespan.
Yes,
okay.
And the body, when the body detects this naturally, it engineers a process that is supposed to kill off these cells, the abnormal ones and the dead ones. It's also a process which can be impaired as someone grows older. So the body is not able to be destroying these dead abnormal cells at a rate
it would want to.
Yes, at a rate it would want to. The pace doesn't match with the rate at which the new cells are being formed. Like that is how cancers are produced. The rate at which these abnormal and dead cells are being destroyed by the body cannot match up with the rate at which new cells are being produced. So
slower than the
yes, it is slower. So the other dead ones accumulate, forming the swellings that we see in cancers. Yes, that is how age plays part. Then the other predisposing factor can be tobacco smoking. Tobacco itself contains chemicals that can disrupt the DNA of the cells. Okay.
Yes.
Okay, that is simple.
That's
English.
okay. DNA is good.
Okay, the DNA
of the cells.
Yes, the DNA of the cell. So if the DNA of the cells is compromised or is changed in any other way from the normal, the cells are going to multiply abnormally. They grow even when the body has not signaled them. Why? Because of the chemicals that are in tobacco and any other substance abusing, especially that involves the smoke. Yes. The other predisposing factor can be, like I had mentioned, delaying to give birth, breastfeed, like not breastfeeding. I want to join this since we are short of time, because they have one explanation behind them. It is not a matter of saying, when you take long to give birth, when you give birth to few children, when you've not given birth all your life, you're going to suffer from breast cancer. No. The issue is estrogen, the female hormone, has a role it plays in
birth and breastfeeding.
No. In enhancing the growth of the breast cancers. Yes. Now, pregnancy, when we are pregnant, estrogen, the exposure to estrogen and its production is interrupted. When we are breastfeeding, the same happens.
Okay.
So imagine a woman that has had, maybe they have given birth to like 5 kids. It means those are 5 years plus, of interruption. Okay, we've not considered how long they are going to breastfeed the child, of interrupting their exposure to the estrogen. So that means in their lifespan, whether they are to live for 50 years or 70 years, whatever God predestined for them, you find that the rate at which they are exposed to estrogen is shorter.
Right.
Yes. That also, in this same sense, we also look at people that start menstruation at a very early age, like 9 years, 8 years old. And remember, they others can get menopause at a very late age, like 50-something. So that is a very long time of being exposed to estrogen. So that means even the chances of developing breast cancer are increased.
Right.
So that is the explanation behind. But even if someone gives birth early, let me say at 19, you give birth to one child, but then you're going to live for 70 years, and all those years of not giving birth, still the exposure to estrogen is there. I would like to give just one more predisposing factor, and that is the exposure to radiations. Radiations, that includes the X-rays, especially if it starts at a young age. These X-rays, especially those that involve the chest, because we know the breasts are on the chest.
Testing for asthma,
like those X-rays, maybe I have a broken rib. Yes, X-ray radiations really predispose us to cancer. Considering the number of times you're being exposed to it. That is why it shouldn't be done unless it is really necessary.
Right.
Yes, because there is that bad side effect. Now, going to the symptoms of breast cancer. There are not symptoms, they are signs, because symptom is what someone feels and you can't see. But these ones we can see. One of them, there will be changes in the appearance of the skin covering the breast. It may become red in people that are light-skinned. In those that are dark-skinned, it may become darker than the rest of the breast.
So the skin becomes botched in a way.
Yes. So there might be obvious swellings. Yes, that you can see vividly with your eyes. There is, we know that shape of the breast, but when you compare it to the normal breast, you may notice that there is alteration, there is disfiguring. Yes, there is deformation in the contours of the breast. Those are the curves that the breast has. You will also notice the skin sometimes can become dimpled. We have seen orange peels, like an orange peel. We call it an orange peel appearance. The skin might get those tiny dimples. Those tiny pores. That is a sign of breast cancer, even if you don't feel any mass. Okay, it may not be suggestive of that immediately, but it makes you cautious about what you're feeling. Then the others depend, of course, if someone does a self-breast exam, how the breasts move. Those ones will maybe say at the end of the program how you can do that. And then the other symptom can be, we have the armpits. They have lymph nodes. Lymph nodes are those tiny swellings. You may notice that you're having 1 or 2 that are swollen. Yes. Then the other thing, like I've said, the obvious swellings. You may be able to touch your breast and then feel a certain swelling. A certain part of your breast may be hard on pressing. Abnormal discharge from the nipple or water. Let me call it water, okay?
Right.
Yes. It can be creamish, it can be whitish, it can be bloody. Yes. So for any woman that is not breastfeeding and you're having discharges from the breast, please, it is really important for us. It may not be suggestive of breast cancer, but please go to the hospital hospital for tests so that they can know, is it just a hormonal imbalance that you're producing, like your breasts are affected in a certain way, or is there any other problem that is underlying other than just mere hormonal imbalance?
Right.
Yes, so
Now,
those are some of the symptoms.
Now you did touch on self-testing, and so how can one actually self-test? I'll call it self-screening. Yes, self-screening for breast cancer, because before you're diagnosed for breast cancer, there's a criteria that is followed. Self-breast examination helps you discover something on your own as you're in the house. It's not that every breast mass or lump is suggestive of breast cancer, but it gives us the first step to going to hospital. Like Africans, we have poor health-seeking behaviors.
Right.
Only going for breaking. Otherwise, Panadol and aspirin.
Yes, but if we can do these routine self-breast examinations, it helps us go to hospital before things get worse, because this is something you can notice before anyone tells you or before you see anything really serious. So we go to hospital, the doctor will repeat that physical breast examination. Why? Because for you, when you find a mass or a lump, you will rush, you will write your will, I have breast cancer and everything. But when the doctor examines you, all these breast lumps and masses have different characteristics that are suggestive for different things.
Right.
Yes, some of them are not cancers. So you go to a hospital for a physical breast examination, and depending on the doctor's findings, he will recommend you to do maybe a breast ultrasound scan or a breast x-ray if it is necessary. And then from the breast, we call it imaging. From the breast imaging, the doctor may proceed, depending on the findings. You may not reach all these levels, but depending on the findings at each level, the doctor may recommend that they take off a biopsy or a piece of tissue to check, is it a cancer? What type of cancer is it? Because it also helps in future management. So that is how breast cancer can be diagnosed or checked for.
Okay, is there a treatment for breast cancer?
Oh yes, there is treatment for breast cancer, but we should be very cautious. The outcome of this treatment is always dependent at which stage you're presenting with disease.
Okay.
So if the treatment is effective, and if the cancer cells are detected earlier, there is hope. Yes, there is hope that cancer won't spread to the rest of your body.
So early screening is very important if you actually want
early
to treat.
detection.
Yes, for a proper treatment outcome. Okay. So treatment includes we have chemotherapy. Those are drugs. You take them, you swallow them, and they help destroy the cancer cells. Then we have what we call radiotherapy. Radiotherapy, they use radiations to kill off those cancer cells that are growing. That also helps in reducing the size of the mass. And then the other one can be hormonal therapy. Like I've said, some of these cancers are dependent upon hormones. So when the doctor, when the doctor carries out some of these tests and sees that your breast cancer is very dependent upon estrogen, which estrogen your body is still producing, he will suggest a hormonal therapy that is going to suppress the estrogen production, so that the mass cannot grow bigger, because these cancers are also dependent on the nutrients, the blood supply, and the normal hormones that are circulating in one's body. So for some cases, depending at which stage you're coming in and the type of breast cancer you're having, some people can only be using chemotherapy. Others, the doctor may choose to combine chemotherapy with radiotherapy. Other people, it may be 3 of them. So it all depends on the diagnosis, what stage you've come in with disease. But the best outcome is when we come in before the advanced stages. That is 3 and 4.
Yeah.
Okay, amazing. I would have loved for you to give us instruction. I don't know if you are, but...
Okay. You may want to do a self-breast examination. She had asked earlier, how often is a woman supposed to do the self-breast examination?
Yes.
That should be done every month.
Every month.
Please create time and carry out this self-breast examination. You may not know how to do it, but I would like you to is it logging in?
You can just head over to
Okay, head over to the YouTube Rocket Health Uganda YouTube channel. You just need to look for Rocket Health Uganda. You're going to find this teaching about, actually even more information. We've been limited by time here, but you're going to find more information teaching about breast cancer, all the symptoms that we've left out, all the predisposing factors we've left out, and then the physical self-breast examination. All the steps are there, and it's demonstrated by a woman, so you'll be able to understand all these.
And it's actually still you guiding
oh yes. So you'll be able to do this self-exam at home, teach your friends, and then for better health.
Indeed.
Yeah.